The Onco-D-clare test is a cancer screening test for anyone, or especially anyone that has a risk, a family history of cancer, or maybe have been exposed to environmental toxins for long periods of time. It is highly accurate in that it has an average true positive rate of 92.4% and an average true negative rate of 94.78%. These are very high accurate numbers. And I don't know of any other tests in the industry for liquid biopsies that can really match this screening test for cancer. A lot of the tests out there that are screening tests for cancer involve circulating tumor DNA or cell-free DNA, which depend on the presence of cancer cells, and if it's not depending on cancer cells, such as the cell-free DNA, they're determining the cancer signals through abnormal methylation patterns. And that's what I'm referring to as the Gallery test by Grail. As far as the RGCC Onco-D-clare, it is not dependent on the detection of circulating tumor cells. It is studying healthy white blood cells, specifically the peripheral blood mononuclear cells. We're talking about lymphocytes primarily, and also monocytes and the dendritic cells. Now, when someone has a positive Onco-D-clare test, the question is, what do you do? There are many ways to address it. One is you could do an observation for a few months. If the risk is low or you don't think there's anything going on, there's no symptoms, you could repeat the test in about 3 to 6 months. A positive test, though, means that there is cancer presence in your blood. It is accurate. 9 out of 10 times, if it says positive, then there is cancer. We just don't know the degree, and we don't know the cancer type either. It's just presence of cancer. Now, the second option is to see your primary care doctor, who can do a workup, such as run some tumor markers, blood tests, of course, and do some imaging or scans, such as an ultrasound, X-rays, advanced imaging such as MRI or CT scan. And you may also want your RGCC provider to order the OncoTrace test. That would be the next step, because the OncoTrace will detect the presence of circulating tumor cells, which means at that point there's active disease. If there's no circulating tumor cells detected by the OncoTrace test, but it's a positive Onco-D-clare test, then it's below the level of detection. That means the cancer presence is quite early. In the meantime, you may want to do some preventative lifestyle change, dietary change, and maybe start on nutritional metabolic therapy that helps in preventing cancer. And your provider can design that program for you. You just need to repeat the Onco-D-clare test in 6 months. And if it has become negative, then the presence of cancer has resolved. It's gone. But if it's still positive, you would have to repeat the OncoTrace test to see if circulating tumor cells this time is detected, which would mean then the next step is to run the Onconomics Plus test, which is the chemosensitivity of cytotoxic agents and natural substances, 171 agents total, and their doctor can include additional substances to test or off-label drugs on top of that. But that will give you agents that are highly effective at killing the cancer cells or inhibiting the growth without having to guess it. In the meantime, your primary care doctor may order scans once again to see if something can be detected this time. Whatever the results, the Onconomics Plus will give you the information you need to have the active disease treated effectively. However, if it's a very advanced disease, very aggressive, as determined by the OncoTrace biomarkers, then you may want to have concurrent oncology care as well. But that's your choice. I hope that answers the question on what to do when you have a positive Onco-D-clare test. Until next time, I'm Dr. Donato.